Are you deaf? I told you the same thing a dozen times. Look at me when I talk to you.
Wow, sounds like you're talking to one of our kids. Or maybe it's like what it's like when you go to the doctor and you want to tell them that little message you just gave us.
Yeah, well, this doesn't just happen in our personal life. A lot of people complain that their doctors don't listen to them, they don't care, they don't pay enough attention to them. I mean, how awful to be sick and have your doctor talking on the phone to somebody else while you're there or having their nose in the chart.
It reminds me of when I go to the dentist and he's drilling in my mouth and I have a lot to say. You can't say anything.
Because he's asking you questions.
It's the other way around. And still you want to have that dialogue and say, yeah, right?
Yeah, or the hygienist does the same thing.
Exactly.
Does your doctor order tests or medicines and not really explain to you what they're for? I mean, I think it's astonishing that so many patients are discharged from the hospital and they don't even know what their diagnosis is and they don't know what their medications are for. And a lot of people don't take responsibility for their health. And the ones that do, and they look it up on the internet, they're often reprimanded by their doctors.
We have a problem, and it's a listening problem. And some of it's because medicine has become more technical and more scientific. It's not such a personal thing. It's not got the spiritual side to it. It's not the touchy-feely stuff, although many doctors are very much like that.
Like you.
Absolutely. And are connected to their patients. But when you're in a situation where your patient's not comatose or is comatose, and the family's not there much, you can understand how that might happen. But in a situation where you're all alert and coherent and want to know what's going on, it's a whole different story. Tell us a story about what happened when you took your father to the cardiologist.
Yeah, I took my dad to the doctor, and we were sitting in the room waiting for the doctor to come into the examining room, and he comes in with the chart, and he turns his back to us, and the whole time that we're sitting in the chairs over here, he's looking at the chart and going through it. Never looked at us, never shook hands, never said hello. Finally, I'm like, "Hey, Joe." And he turned around, and it's like, "Oh, Vicky." It's like, "Yeah, this is my dad and my mom." And, I got him, or I caught him.
Well, absolutely. But it gets that way. When you're just trying to do the right things and make sure that you're taking care of the technical side of what's important. Do we need to change the drugs? What are the vital signs like? When you examined the patient, did you notice something that was an issue? Did you do an EKG or a chest X-ray? And then you don't have time to explain all the things that are there. You kind of rush through it.
Yeah,
At least many doctors.
But you've told me that many times you can figure out a patient's diagnosis by just listening to the patient.
Oh, for sure.
So it's important for the doctor to listen to the patient.
The most important way of getting a diagnosis is to listen to your patient. But you have to have time to do it.
And also, sometimes the patient doesn't know what to volunteer. The doctor needs to know what to ask the patient, too. Like if a patient is having a symptom, maybe it's because of the side effect of one of their medicines.
Or maybe it's because of some old stresses.
But if they don't tell the doctor and the doctor doesn't ask them that, it might not even come up. And then they're still taking the medicine, and then they're taking another medicine to counteract the side effects from the other one.
All right. There is no substitute for listening and caring about patients, because it's a very personal and sacred relationship. In my own practice, I charge people for an hour's visit when they first come and see me, but I book an hour and a half. Now that costs me income, but it's more important to me to be able to get it right and be able to listen to my patient and be able to not only know what's wrong with them, but know how that affects them and their family and then their entire situation with their community.
It's like a therapy session.
It's body, mind, emotion, and spirit. It's holistic medicine. It's the way that you want to treat people and want to be treated yourself, because there are a lot of reasons why we get sick. And not all of them are just because an unlucky roll of the dice.
I've met people that don't even know their doctor's names. They belong to some big health group and
there's a different doctor every time?
Well, or even if they have the same one, they don't know the doctor. The doctor doesn't introduce themselves. They just don't know.
It becomes a job. It's a job. And what the doctor is responsible for in terms of the work ethic that's expected by the people that employ them is to be able to be sure that they're treating the patient with the right medications and the right supporting structure that's necessary, using the right technologies. It's more academic than it is personal, and it's a shame because we've lost the care in healthcare.
Well, if patients are heard, there's better outcomes.
For sure.
Yeah, and a good bedside manner is really good medicine.
Oh, what happens when you don't have a good relationship with a patient, or they come in with something that you don't know much about because they've been on the internet and they're collecting all this information? A lot of doctors are threatened by that, and they don't know that information, and their training is limited to just what they got in their medical school training, internship, and residency. And that may not be sufficient. For me, it's a special treat when somebody comes in with a stack of papers, says, I've been reading about this on the internet, and it's different from what I'm getting from my doctor. That really pleases me because I know they're interested in taking care of themselves and doing what's right for them to get the right treatment that they need, considering their whole essence and how that fits in with their entire life story.
Yeah, they're taking an active role in their own health care and taking responsibility for their own health. And we all need to take responsibility for our own health. But many people have like a mental block about it or something, and they expect their relatives
They don't
and
wanna
their
be bothered
families
by
to take care of it for them, or for just trust what the doctor says, and they just take the pills and don't know what they're taking.
Well, we've got this myth where we expect to get sick, and when we do, we expect to go to the doctor, and we expect the doctor to be able to give us a magic pill or a technology or some other something special that's going to do for us what we wouldn't do for ourselves. And what we forget is that lifestyle is the most important medicine in the universe, and you have to be able to honor that if you want to be well.
You have to pay attention to the style in which you live your life.
Absolutely. If you will do that, you're going to do a lot better. So when your doctor's not listening, you're going to have to do the best that you can to get his or her attention. Maybe send them an email or send them a letter or let them know in some way when you have time to think about it, so that next time you come in, maybe they'll have a little better way of treating you so they can listen and care.